Hi there, this is Ed from Refresh Movement, and what I'm doing here is just a quick overview of what exercise rehabilitation is and what I offer here at Refresh Movement. So I've been an exercise rehabilitation therapist for 11 years, initially with the military, treating everything from amputations to multiple fractures and chronic long-term issues. What exercise rehabilitation essentially is it is a treatment using movement and exercise. So it's an exercise modality to treat injuries from acute to chronic or just to improve someone's general function. What that comprises of here is an initial assessment where I will do a full musculoskeletal assessment of the client. And what I'm looking at here is their range of motion, both active and passive, their muscle quality in terms of strength or in terms of its activation or in terms of how it works synergistically with other muscle groups. Also, I'll be looking at their movement control, their movement patterning and quality. Once we've established where their problem areas might be or what is contributing to their symptoms, I will educate the patient on my findings, and I'll give them an initial exercise prescription program to go away and start working on in order to reduce symptoms and restore function and restore movement quality. In the review appointments, I will retest what we measured before to look for progressions and look for areas of improvement. Once we've retested and we've seen where we are in terms of what's getting better or what's not, I will expand and progress on the exercise prescription I gave them before. During this session, I'll take them through that on a one-to-one basis. So I'll look at the quality of the way they apply those exercise techniques. I will give them things such as mobility. I'll restore function, restore range. So this will be done on a one-to-one basis in that review appointment. And then they will leave with a progressed program to address the issues they have, whether that is a lack of range of movement, whether that is reduced stability around a joint, whether that's reduced muscle function. They will then be able to go away and work on that and start to see progression in those areas. In addition to an initial consultation and a review, I offer exercise rehabilitation classes. Now, this is similar to going to a normal exercise class that you might go to a gym, but it is specifically targeted at their symptoms. So typically, if I had a back class, it would involve 4 to 6 clients who are struggling with back pain. And the session would consist of exercises in and around improving their stability, their movement control, their movement strength, and restoring confidence in their movement generally. I might run these classes for 4 to 6 weeks, hopefully the same groups coming back. The idea of the group being working together is that they have a bit of confidence because they're working within a small team, they can motivate each other, and also they can see that maybe one of the other clients is in a bit of a poorer condition than them or struggling a bit more, so it restores their own confidence that way. It aims to rebuild and restore function in each and every session, and it would progress in terms of challenge and intensity over the 6 weeks, depending on where they are in themselves. In addition to those 3 things, so the initial consultation, a review appointment, and group-based therapy, I also offer sports performance improvements. So somebody comes in who competes at various levels. We will establish where they want to get to or where they feel they may be struggling with. And sometimes it's looking for the small things to make the big changes. So I'll be able to analyze their performance, their power, their strength, their speed, any of those areas. Once we've found out areas of improvement, I will then give them a periodized training program to improve their performance in whatever their sport is. I hope that gives you an overview of what exercise rehab is and what we offer here at Refresh Movement. If you need anything else, just give me a shout. Thank you.